Let me talk few questions about hypertension. Question number one, at which state or classification of hypertension should the drug therapy be started according to JNC7 report? When anybody is diagnosed by stage 1 hypertension, they should be treated by antihypertensive medication. Because the primary hypertension has no identifiable cause, the treatment is based on interfering with physiological mechanism that regulate the blood pressure. Thiazide diuretics treat hypertension because. So, what are the mechanism of thiazide diuretics to reduce the blood pressure? They deplete the body sodium and reduce the fluid volume. Fluid volume reduce means blood pressure reduce. Next, because of its action on various body system, the patient taking thiazide or loop diuretics may also need to receive. So loop diuretics or thiazide can cause hypokalemia. To prevent hypokalemia or electrolyte imbalance, you could educate your patient to take potassium rich food or supplement. All patients with hypertension benefit from diuretics therapy, but those who benefit the most, African American hypertensive patient, the drug of choice is diuretics, right? Beta blocker that treat the hypertension because, so what are the mechanism of action of beta blocker? They reduce the peripheral resistance. When peripheral resistance reduce, blood pressure also reduce. Which of the following disease process could be made worse by taking non-selective beta blocker? So the contraindication of beta blocker for asthma and diabetic patient, right? C, both might be worsened. Disease state in addition to hypertension in which beta blocker is a compelling indication for use of beta blocker include. It is myocardial infarction. Question 8. Angiotensin converting enzyme inhibitors treat the hypertension because how they work or what are the mechanism of action ACE inhibitors. They reduce the sodium and water retention, decrease the vasoconstriction, means increase vasodilatation. All is above is correct. Complaining indication for ACE inhibitors to treat for hypertension based on clinical trial including. So, which medical condition we do not use ACE inhibitor? Renovascular disease, renal parenchymal disease. ACE inhibitors and other class of drug may reduce the proteinuria in patient with diabetic better than other drugs alone. So it is calcium channel blocker. So ACE inhibitor and calcium channel blocker may reduce the proteinuria in patient with diabetic. If not chosen as the first line in hypertensive medication, what drug class should be added as a second steps because it can increase the effect of most other antihypertensive drugs. It is diuretics, loop diuretics or thiazide diuretics. Treatment costs are important for the patient with hypertension. Which of the following statement about the cost is not true? Few antihypertensive drug comes in generic formulation. It is not true, not approved. Caffeine, exercise, and smoking should be avoided for at least how long before measurement of blood pressure? At least 30 minutes before. Blood pressure check in the children. It is mandatory or it should be done during the every health care after the age of 3. Lack of adherence to blood pressure measurement is very common. Reasons for this lack of adherence include lifestyle change are difficult to achieve and maintain. Adverse drug reactions are common and often fall into the categories more associated with non-adherence. Cost of drugs and monitoring with lab can be expensive. So all is above. Lifestyle modification for the patient with pre-hypertension or hypertension include we tell our patient to adapt with DASH diet, right? So we try to non-pharmacological management first. We provide dietary approach to stop the hypertension. D stand for dietary, A for approach, S for stop, is for hypertension.